Hi, I'm Dr. Alicia Beth Eisenstein, and I own the Banfield Pet Hospital. It is a franchise that I own with my sister, Dr. Eisenstein-Rosen, and I'm very interested in doing a veterinary education program that you guys are looking to air in September. I've owned this practice for almost 10 years, and I'd like to show you my practice. So let's go inside, even though it is a beautiful day in Chicago, finally after a bunch of flooding and snow. So although I'd like to stay outside, let's go inside. This is a 4-doctor practice that's been going since 2003. So as you see, we have a grooming facility, a pet care, but I think we're most interested in what's going on back here. How do you come along? We have a waiting room, 3 exam rooms. We're trying out for an education series. With this, I'm good. How are you doing? How's Charlie doing?
He has diarrhea.
Oh no! But his legs doing better?
Pardon?
His legs doing better?
Oh yes.
Oh good.
No issues with the leg.
No? Oh good. And I just talked to Ames, ready?
Yeah.
Okay. So this is my practice. We have a waiting room, a front desk. We've got 3 walk-through exam rooms, kind of with it. In each of our exam rooms, all of our computer system, we are completely computerized. We have all touchscreen computers, so whenever anyone comes in, we can go through all of their medical records, and we can show them everything on the screen. It's completely computerized. And if they want to see any of their records or kind of any of their vaccines, everything comes up completely touchscreen. So we're completely in the 21st century? 22nd, I don't know, whatever century we're in now. We're completely top of the line, kind of with that. With our walk-through exam rooms, you walk through and you go straight into the pharmacy. Everyone is on their lunch break, so everything is a little bit messy right now, kind of with it, but now you're in the pharmacy area where we have all of our vaccines, all of our medicines. We have the ability to do in-house blood work, but we also kind of send out anything that you need, kind of with it. So all of our lab work that gets done here. As you kind of keep walking through, we have more of our lab stations with it, our doctor kind of stations where they do their medical notes with it. We have places for all of our pets that just had surgeries or might be doing drop-offs with it. As you keep walking back, kind of with it, our hospital's built very, very long with it. You keep walking back. We'll be updating probably within the next year to digital x-ray, but we are still on film, kind of with it. We have our isolation room. These are my dogs that I was telling you about. My 8-month-old French bulldog, and Uzi, my 5-month-old golden retriever.
Oh, I shouldn't say his last name.
Lucky. This is Lucky.
Yeah, thank you.
He is going to be our surgery today.
How about the surgery?
He is our bilateral inguinal cryptorchid surgery. And so we're going to get the catheter in, and then we're going to get him down, and then we will be back once he is all down, and we are going to be tag teaming this surgery. So we can stop, and then once he is under, we will be filming again. Prepping this dog for surgery. Neither of his testicles descended into the scrotum. So I'm just going to get this dog all shaved while Dr. Rosen goes and gets scrubbed up.
Oh, it is so small.
So what are you doing? What kind of surgery are you doing today?
So this is a bilateral inguinal cryptorchid. So neither of the testicles made it down into the scrotum. So typically on these, Jory and I like to tag team them. So if there's ever a problem, then there's always another pair of eyes. It's always nice to have another doctor in here. I went to veterinary school, and then Jory followed in my footsteps 6 years later. Yep, 6 years later. Most people think we're twins. We're not, even though we look a lot alike. A lot of people kind of think that we are.
Disappointed that the pepper isn't just fat. But, wait a minute. We have removed testicle number 1.
I don't know if I really want
It
this.
was, well, it was inguinal. It was underneath the muscle.
We like to sing in surgery.
Beautiful day to save lives.
It's always a beautiful day to save lives. We stole that from Grey's Anatomy, so I hope there's no copyrights.
Derek Shepherd.
Glue. So while I'm finishing closing, Dr. Rosen is going to start on the second testicle, which we don't have to find because it was nice enough to leave the abdomen, just not make it to the scrotum.
And it still is not normal.
Definitely is not normal.
So if you could please hand me a hemostat.
I will be handing her a hemostat.
And clamp it up for me.
We've always hand tools upside down.
I please have the tool.
I'll be handing her the tool.
And now we shall be doing some anesthesia.
But not really, because dogs sometimes get a little upset that they don't want to lose their testicles. The main reason for removing these testicles is because, as you can see, these are not normal testicles that aren't normally developed, and so these have a higher probability of becoming cancerous.
That is true.
Do you concur, Dr. Rosen?
Definitely concur.
And because Bob Barker told you to do it.
Definitely Bob Barker from The Price is Right.
Alright, kind of a Frito.
I am now scrubbed out, so you don't have to. I can pass these around.
That's okay. Good. No, bleed.
Huh?
Bleed. Perfect, and you can see that that is holding quite nicely.
Okay, the last room that we're gonna walk into is gonna be the surgery room, where I think Dr. Rosen is just finishing up a dental.
Oh, you're back.
We are back.
Hello.
So we just did a tour of the hospital.
Oh my God. Okay, the turn. Why would you give me this dog? You know I hate dentals.
Dr. Rosen loves soft tissue surgery. She is not a big fan of dentals. She loves clean teeth, but she thinks that dentals are really disgusting,
And
so
this
she
dog
likes me
is
to
the
do
most
it.
harder I have ever seen in my entire life.
So Dr. Rosen is finishing up a dental with the help of Beth. So she's going to be finishing the dog dental.
We're just flipping the dog.
So they are flipping the dog right now. Dr. Rosen spends 2 mornings a week, or afternoons a week, seeing appointments, but she just came back from maternity leave. We've got her 2 kids here, Golan, Siona, and then Yola, who helps out watching. Golan, you want to say hi? Say hi to the camera.
Hi.
And then Siona, can you wave?
Golani,
You say
tell
hi?
the camera what mommy does.
What does mommy do for a living?
What am I?
What is mommy?
A veterinarian.
Yep. So Golan sometimes comes out and helps us. And then Siona sometimes hangs out also at the clinic. So that is our practice. I hope you like our video. And we look forward to hopefully being picked. So thank you for watching, and we hope you enjoy our show. Gloria.
We've always thought that a reality show would be perfect for this.
It's really an education
We
series.
always thought that an educational series would be right up our alley.
But it's a wonderful day to save lives.
Wonderful.
Wait, let's get,
Wonderful day.
Wonderful day.
So pick us.
Yeah.